confirm that they will answer your question.
So have they met with this company?
Again, Mr. Chair, I think with respect to specific meetings with specific companies, we'd be happy to get back to the member with the details, but we don't have them on hand.
It's interesting that the website of Safe Supply Streaming Company talks about a market of $360 billion in legal narcotics, including cocaine. Minister, it seems interesting that now we have companies in Canada getting licenses to, as I said, possess, produce, sell, and distribute opium, morphine, heroin, and cocaine, all under your Liberal government's idea of legalization. Is that true?
Mr. Chair, all of the narcotics listed by Dr. Ellis are legal and restricted are under strict regulations. They're also used for medical purposes in hospitals and also in research settings.
Interesting. So what I said specifically, Minister, is that they can legally possess, produce, sell, and distribute these drugs. Is that true?
Clearly, Dr. Ellis isn't interested in the importance of research science and medical treatment use of these highly regulated narcotics.
Excellent. So what you're telling me is that these drugs will never be legal to be used outside of research settings in our country. Is that true?
That is correct.
And oddly enough, it's stated that the Health Canada licenses are for research purposes only, as you have attempted to say. But the CEO of Sunshine Labs says since inception, we have been proactively pursuing amendments to our dealer's license to include MDMA, coca leaf, cocaine, opium, morphine, and heroin to position ourselves as a legitimate, safer supply partner. Have you or your officials had meetings with this company?
Jen Sachs can answer with regards to meetings.
So we have met with Sunshine Labs. Sunshine Labs is a licensed dealer. They did publish misinformation. We did follow up last spring when that misinformation was published in terms of selling to the public. They are not authorized to sell to the public, but licensed dealers can conduct certain activities with controlled substances for medical and for research purposes, depending on the substance and depending on their license.
Don't you think on behalf of Canadians it's very concerning that a former medical officer of health in BC set up a company to import heroin into this country, and now the current Minister of Health there, with your cooperation, Minister, is attempting to legalize other substances in this country. Is that not concerning to you? Should Canadians be concerned about that? I know I am.
I think it's important that we address the facts with regards to Fair Price Pharma and not speculation. Dr. Perry is an esteemed and well-respected physician. Fair Price Pharma is an early-stage company looking at research potential in addressing substance use and addiction, and consults with Health Canada on what are the proper channels and regulatory bodies.
Thank you, Dr. Ellis, and thank you, Minister. And next, Ms. Sidhu, please, for 6 minutes.
Thank you, Mr. Chair. I would like to thank the Minister and all the officials for being here with us today. First, Minister Sachs, I believe you wanted to add more information with regards to Dr. Ellis' question. I would like to give you a few seconds to answer them first.
Thank you. And through you, Mr. Chair, just to clarify, any company that seeks to engage with Health Canada with regards to inquiry on licensing or permitting on what is an extremely rigid regime in which we must comply according to international treaties and the INCB, requires that all regulatory standards are in place and they can only import or export for medical treatment use or research.
Thank you. Minister Sachs, my next question is that recently I had a meeting with my youth council, and they clearly told me about the need to have mental health tools available for them. So I just want to, if you can tell us, could you expand on our youth mental health funding program? And also, if you can talk about recently announced integrated youth services collaboration centers, the increased funding for these centers.
Thank you to the member, and through you, Mr. Chair, what I'd like to say is the Integrated Youth Service Program is a hallmark of what we can do to help youth in every part of this country in meeting their needs in community with a full range of services, including primary care, counseling, and support to families as well. But with regards to the Youth Mental Health Fund, we are really, really excited to be working with a youth-led and expert-led consultation process right now that will be a once-in-a-generation investment in our young Canadians. We know that mental health challenges have been growing amongst our youth, and we also know that we need to meet them where they are so that we can offer them the services that they need and deserve so that they succeed and thrive. Because we know when our young people thrive, Canada will succeed, which is exactly why these investments are needed at this moment, particularly after COVID. With regards to recent investments, we've been building out the Integrated Youth Service Program for quite a number of years. There are now 48 hubs throughout the country, gathering data, knowledge, and working with youth every single day. And now we have made a $59 million investment to network the network so that knowledge exchange, increased support, and an evidence-driven approach to addressing youth mental health and wellness and well-being will be the future of young Canadians. I would like to defer.
You.
Okay. Go ahead.
Next questions to Ms. Jeffrey. My next question is that, Ms. Jeffrey, could you please talk to this committee about the work of your department to implement the National Framework for Diabetes?
Can you specify to who that question was to, Ms. Sidhu?
To PHAC, Minister.
So I would suggest
Ms.
that
Jeffrey.
Nancy Hamzawi is here on behalf of PHAC, and perhaps she can answer your question if you don't mind repeating it.
Yes, please. Could PHAC can tell us what the implement of National Framework for Diabetes, what's happening?
Sure. Thank you very much for the question. Back in October 2022, the Framework for Diabetes in Canada was released, marking a major milestone to better support Canadians. Through a budget 2021, the government committed $20 million to research through the Juvenile Diabetes Research Foundation and the Canadian Institutes for Health Research Partnership to Defeat Diabetes, including $15 million matched by the JDRF. On February 29th, you all have been party to discussing Bill C-64, and the discussions around National Universal Pharmacare, with diabetes being a very important pillar to that bill. Thank you very much.
And could you expand the conversation with the provinces and territories as they work on implementing their own plan in aligning with this?
So we work very closely with our colleagues in the provinces and territories. We have a public health network as well as the Council of Deputy Ministers, ultimately leading to support the ministers across the country. We've had several conversations, have exchanged best practices and experiences to make sure that we have that coverage coast to coast to coast.
Thank you. I'm coming back to Minister Sachs. Minister Sachs, can you talk about the bilateral agreement with the provinces and the historic investment in mental health care, if you can elaborate on that?
Thank you for the question, and through you, Mr. Chair, over the past year with Minister Holland, we've signed 26 agreements for every province in total for province and territories, totaling $200 billion in investments into the healthcare of Canadians. Part of that work was based on 4 key principles, one of them being mental health and substance use. The cumulative result of that has been that with those agreements, over a third of the funds allocated across provinces and territories is dedicated to mental health and substance use services. As I said in my opening remarks, the federal government is a partner with provinces and territories, understanding that their jurisdiction is responsible for delivering healthcare services, mental health services, and substance use services. And we work with them to support them in what they need for their communities.
Thank you, Minister. Suite, Monsieur Thériault, pour 6 minutes, s'il vous plaît.
Now, Mr. Thériault, for 6 minutes, please. Thank you, Mr. Chair, and welcome, Honourable Minister. Let's try to have a conversation about the toxic opioid and toxic drugs crisis. The last time I put questions to you on this matter, we were discussing the seizure carried out by the RCMP. There were allegations to the effect that part of the stash of drugs seized were counterfeit drugs, but came through diversion of supply intended for safe injection sites, safe consumption sites. So you didn't have a full set of answers for me then. Could you now tell us more about what was at issue, what happened with this seizure, where these drugs came from? Have you been able to get to the bottom of this?
Thank you for the question, and through you, Mr. Chair. As the member knows, diversion is illegal of all drugs, whether they are ADHD medication, hydromorphone, or OxyContin, which was also commented recently in the media, all prescribed drugs that are not for their intended use and user is illegal.
Excusez-moi, Monsieur le Président.
If I may, Chair, I have trouble understanding the interpreter. I don't think the interpreter is speaking close enough to the microphone, so it's very difficult for me to hear the translation, the interpretation. I'm terribly sorry, Madam Minister.
Allez-y.
Go ahead. Continue.
Est-ce que c'est
Is there
réglé
interpretation now?
Monsieur Thériault?
Are things working for you now, Mr. Thériault? Yes.
Go ahead.
Okay. As I was saying, Mr. Chair, diversion is illegal of all prescribed medications that are diverted and not for their anywhere that they are not for their intended use. We do know through the RCMP that in the seizures that they have conducted, there has been no increase, according to DAS, which is the main data source that we use, of an increase of hydromorphone in diverted and seized operations. That being said, it is certainly an issue of concern for me, and we have worked very diligently with the department to oversee what mitigation measures we can ensure when it comes to our safer supply programs.
OK, donc vous n'avez pas encore...
Okay, so it seems to be a mystery. That's what I understood from the interpretation. So you still haven't shed light on the situation. We still can't tell where these drugs were from. We know that part of it is from diversion of safe supply. Is that what you're telling us, or we're just remain unsure? We're not sure.
Obviously, I can't speak to the specifics of an investigation that's being done by law enforcement. However, there is no mystery here when it comes to that. That diversion does take place. As a matter of fact, Fiona Wilson, when she was here, did talk about that diversion is a reality, which is why law enforcement has to play an important role in our full set of pillars of how we address the illegal toxic drug supply. But if the question is how much more, or if there is more, there have been allegations to such made by the Conservatives. We know both from the RCMP and also from DAS that there is no evidence of a systemic diversion of safer supply.
OK. Parce qu'à l'époque, c'était pas si clair que ça que...
Oh, okay, because back then it didn't seem that clear to the effect that there wasn't any systemic diversion of safe supply. Okay, so this said, I understand there may be further investigation. Are you aware of how such an investigation will take place without necessarily providing undue details? Are things moving forward? Will we eventually get an answer? Will we eventually get to the end of this investigation? It's been ongoing for months, I understand. And was this an isolated incident? What's the information you have? I mean, yes, it of course, enforcing the law is an important pillar in the national strategy. That's why I'm putting this question, because we tend to forget this. Witnesses have come to tell us that, fighting against drugs, that's not something we can ever win. Prohibition, coercion, it's never going to solve the problem fundamentally. But nevertheless, using the law is part of the strategy, and we don't seem to speak to it often enough. Another question about having requirements respected. Have you undertaken to create any regulations, make any regulations about precursors? The precursors that are allowing people to operate the clandestine labs that put out these very dangerous and killer drugs.
And through you, Mr. Chair, I would agree with the member. The concern of precursors is one that we are definitely occupied with. As a matter of fact, both last year and this year, I have signed off on new regulatory regimes on recent precursors that we have seen coming into effect on the streets of our on the streets and in through seizures that we've seen. But to be frank, this is what we are most vigilant about in making sure that we highly regulate precursors.
Excuse
it is
me,
a
Minister.
complex.
Excuse me.
Yep.
The bells are presently ringing. Can we have that is the end of Mr. Theriault's turn. The minister can finish her answer if we have unanimous consent to continue. Is it the will of the committee to keep going for another 20 minutes at least, and then I'll check back with you? Are you able to do that, Madam Minister? Okay, if you could briefly complete your answer to Mr. Theriault, and then we're going to go to Mr. Johns. Thank you.
So to be succinct on this, what I will say is we are in a constant process of evaluating and highly regulating precursors when it is needed, and we know that it is needed. But I would also highlight that the complexity of precursors and regulating them is that they are found in other industrial uses that we use every day, such as paint and other products. So we need to be vigilant, and we are. We are also part of the International Drug Coalition on Synthetic Drugs, which addresses precursors, as well as the trifentanyl group.
Thank you.
To be on top of it.
Mr. Johns, please, for 6 minutes.
Minister, in the past, you've agreed that the toxic drug crisis is a health issue. Is that still the case?
Absolutely.
So, Minister, you know that it's illegal for people to have personal use of or even have illicit substances on them in Canada everywhere east of the Rockies. You're aware that is the case right now?
Yes, I'm aware.
Okay, so that being said, it's a criminal issue in this country. Would you not agree?
I would say that at this point in time, decriminalization is only available as in British Columbia to refer people to health services.
Okay, so you agree that it's a health issue. Your government, the Privy Council, went out and did polling to see whether the Canadian public supported decriminalization. Polling was mixed. If the polling was really high in support of decriminalization, would your government gone ahead and moved decriminalization sweepingly across Canada?
First of all, thank you for the question, and I want to thank the member for his advocacy. As I've said, both in this committee and in the House, as we move to address this health crisis, we also have to make sure that we have all tools in place, both from a public health and public safety lens, which means that we have to ensure that full wraparound health services are in place as we move forward with other tools such as decriminalization.
Minister, I can't think of another health issue where the government's going out and doing polling, whether it be heart disease, liver disease, what decisions they're going to make, how they're going to maneuver around health. Can you think of one?
The Privy Council office does polling on a myriad of issues.
Has the Privy Council done polling of the 42,000 families that lost loved ones, or whether they should ramp up and scale up a safer supply of substances to replace the toxic drug supply?
I can't speak to if such specific polling was done, but what I will say is that I meet with families across the country constantly, unlike the opposition who refuses to meet with families, including Mom Stop the Harm.
You believe that this is an addiction crisis or a poisoned toxic drug crisis?
This is an issue of a poison toxic drug crisis that is leading to an addiction crisis.
Right. So right now, your government is making policy decisions, health policy, on polling. This is absolutely cruel and harmful. The stigma is so real just by doing the poll on decriminalization. Do you not agree? Do you not see this?
I thank the member for his question, Mr. Chair, but I find the question, first of all, rather odd. We base our policy on evidence and science and interactions with health experts from across the country so that we have a full and robust understanding. I don't think any responsible government addressing healthcare would guide their policy strictly on polling, so I take issue with that, Mr. Chair.
Well, I can't think of any government doing polling on healthcare policy and healthcare decisions. So that's my response to that. Now, we know that there is nowhere in this country, no territory or province, even the Alberta model that's got one therapeutic centre built out of the proposed 12 or 13, there is nowhere that we have treatment on demand. I don't think we need to go and poll the public to see that we need to scale it up. Why has your government not found a way through the jurisdictional quagmire like you did through COVID to ensure that we have a treatment and recovery program on demand to meet people where they're at now?
Through you, Mr. Chair, I thank the member for his question, and as I've stated earlier, this is exactly why, in addition to the $200 billion of agreements, of which 25 billion of that of the 25 billion, mental health is a key principle. This is why we're making these investments in health jurisdictions. This is why we've put a $595 million towards over 400 projects through SUOP. This is why this government has put $1 billion on the table to address substance use and the overdose crisis in this country since 2016.
Mr. Johns.
So you've got the Canada Drugs and Substances Strategy, and it's just that, a strategy. There is no timeline, no dollars tied to that timeline. Portugal took an approach where they had a timeline, they had resources tied to the timeline. Minister, you have still not laid out a plan. We had an auto summit. I asked you repeatedly when we're going to have a First Minister's summit on this crisis, not saying that auto theft isn't an issue, but this is a real issue. You said you were going to reinstate the expert task force. We have not been explained or told how that's going to roll out. When is the expert task force going to roll out? When are we going to have a First Minister's meeting? And when are you going to actually table a plan with a timeline? People are dying rapidly. You don't need to do more polling to figure that out.
Through you, Mr. Chair, thank you for the question. I believe we are on a plan. The CDSS is exactly that. However, every agreement that has been signed with every jurisdiction is attached to a work plan of their plans of what they know best for their communities and the investments that they need to make in addressing the mental health and substance use crisis. That being said, we continue to work with them. We continue to add additional investments, whether it's through SUOP in the most recent round of $144 million, whether it's through the Emergency Treatment Fund, which will be rolling out in the fall. We have to work with jurisdictions and we have to work with communities. They know best.
Minister, it's still spending less than 1% than what your government spent in response to COVID. Why? Because of the stigma. That is so clear and evident right now.
Brief response, please. We're out of time. Minister?
We are addressing this as a public health crisis with the utmost priority.
Thank you. Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair. Alors, Madame la Ministre, tout récemment...
So, Madam Minister, very recently, a supervised injection site opened its doors in the Saint-Henri sector of Montreal, right near a school and a childcare center. Children have to make special efforts to step over used syringes and avoid drug users. As my colleague Gérard Deltel put questions to you about this, I'll point out that your answer was you were unaware of this site. So what can we tell parents who are rightly worried about this?
Through you, Mr. Chair, I'll thank the member for her question. And the member should know that this is a provincial safe consumption site that was authorized and is regulated and operated by the province. In my own perspective, as certainly as a mother and as minister, as I've said repeatedly, and I say here now, public health and public safety are a priority in addressing the overdose crisis. However, in doing so, we also have to meet people where they're at in community to have accessible health care, which this is what safe consumption sites are.
Merci, Madame. Alors, la site de consommation sur...
Thank you, Madam. So the Benoît Lobre safe consumption site, this is what I asked a question about, we've seen is not on the website of Health Canada as being an approved site. So has it not been approved? Is it under the open application section that it's been approved of?
Yes.
So effectively, there are these injection sites that require to have an exemption under Section 56.1 of the Controlled Drugs and Substances Act. And it can have an open application with Health Canada, not be approved by Health Canada, and be allowed to operate. Is that correct?
As I stated, this site is operated and was authorized under provincial jurisdiction.
Has an exemption been given to La Maison Benoît Lobre?
I believe the member answered her own question when she referred to the website.
So how is it allowed to legally operate if there has not been an exemption given?
Because safe consumption sites are part of healthcare. Harm reduction is healthcare. I may feel I need to remind the member of that.
I would also remind the minister that its words matter and it is not safe, it is supervised. Her own website actually even says supervised. So we're effectively, there are injection sites that are operating that do not have the legally required exemptions through the Controlled Drugs and Substances Act, and you're completely A-okay with this.
Through you, Mr. Chair, I thank the member for her question and will remind her that from the healthcare lens that we are operating in, harm reduction is a key pillar of healthcare service provision, which does include safe consumption sites and overdose crisis sites. That being said, with regards to her specific question on this site, I will defer to officials.
Thanks very much. I'll just clarify that for the exemptions, there's individual site-specific supervised consumption sites that can be authorized under subsection 56.1, as you noted. There are also class exemptions that have been provided to each province and territory to be able to authorize urgent public health needs under their own authority. And so Health Canada has issued a class exemption to provinces and territories, Quebec included, and it is under that class exemption that the current supervised consumption site or overdose prevention site that you're referring to is operating.
Okay, so the City of Montreal made a request to go towards the British Columbia model. Has that been rejected?
I believe the Mayor of Montreal was very clear in her public media statements that there is no such request at Health Canada.
So how many applications are into Health Canada to adopt a BC-like model of legalization of hard drugs that are currently sitting with your department?
I'll ask an official to answer that, but as to my knowledge, there are none. Do you want to say that it's correct?
That's correct. Yeah, there are none.
So there are currently no applications whatsoever that have been received by Health Canada. And will you commit now to rejecting any future applications that will go forward?
I don't deal with hypotheticals. I address each community and its requests in addressing the overdose crisis in their communities and their knowledge and understanding of what they deem as best. Then we trust evidence, science, expertise, and healthcare service provision.
Minister.
So
Thank
given
you,
the
Ms.
large
Goodrich.
workload the committee has on the
Next, we're gonna
docket
go
and the
to Dr. Hanley, please, for 5 minutes.
Thank you very much, Minister and officials, for appearing. We have just heard in the last questions what I think is a stigmatization of an ongoing stigmatization of drug use. In this case, around the proximity of an exempted supervised consumption site from in proximity to to public settings. I feel this is one part of confusing the public usage of drugs and decriminalization and trying to establish a causation between the two. I also hear blaming the toxic drug crisis on diverted hydromorphone. I've also heard of demonizing the use of diacetyl morphine as an example of under very strict conditions of using medical therapy for addiction. So all to say, can you comment on the role of disinformation in how this is affecting our ability to work with partners, provinces, and territories to address the toxic drug crisis?
Thank you for the question. And through you, Mr. Chair, I would say that certainly my department and myself, we're focused on saving lives and connecting people to health care. That is our first priority. We don't subscribe to the Conservatives' ideological and often ignorant approach when it comes to this overdose crisis and the illegal toxic drug supply.
Point of order, Chair.
Dr. Ellis?
No, I think that this meeting's been going reasonably well. I think that using inflammatory remarks, such as the word that the minister's chosen to use at the current time, really is not conducive to furthering this conversation, especially when the member opposite has raised the sensitive topic of disinformation. So I guess what I would suggest is that just because someone doesn't agree with the minister doesn't make them ignorant. If we're going to be doing name calling here, I think we could descend very quickly into a state of back and forth, which will not be productive. Thank you.
Point of order, Mr. Chair.
You have a point of order, Ms. Kayabaga?
I think that our colleague on opposite has been making similar comments. The minister is making her comments, and we would like to hear from her. Thank you.
I guess I would say this: this has been a charged meeting from the get-go. This is for the minister and for the people posing questions. Let's all see if we can turn down the temperature in selecting our language. I'm not necessarily singling you out, Minister, because some of the questions have been fairly sharp as well. But we all have a role to play. Yes, you have another point of order, Ms. Kayabaga?
I do. Our colleague has also, he did call the minister clueless prior to his comments, and I think that we should rein in those comments.
I'm cognizant of that, which is why I phrased my response in the way that I did. Thank you.
Point of order, Chair.
Mr. Chair.
Okay, we have points of order from Dr. Ellis and Dr. Hanley, but we're descending now into debate. I've made my ruling. I've asked people to tone it down. I don't think we need to beat this to death, but I'll hear you out. Go ahead.
Thanks very much, Chair. I guess I would suggest that if someone doesn't know the answer to a clearly answerable question, then that's actually debate. Clueless.
Dr. Hanley, go ahead.
My point was just that I wanted to preserve my 5 minutes of question and answer time. Thank you.
I think where we left off, the minister was in the middle of answering a question from Dr. Hanley, and Dr. Hanley, you are 1 minute 50 into your 5 minute turn, so you still have 3 minutes and 10 seconds, and the minister has the floor.
Thank you. And through you, Mr. Chair, I'll just try to be succinct and accurate in answering Dr. Hanley. To be frank, Mr. Chair, there's a false debate brewing of harm reduction versus treatment, and it's a distraction because we're focused on saving lives. We are focused on those who use substances, who have the disease of addiction, and getting them to healthcare services. And we know that this is where we need to stay within the evidence and the science. Professor Benjamin Perrin has also raised issues about disinformation, calling out the leader of the opposition on his claims about hard drugs, crack, heroin, and cocaine being decriminalized and resulting in a 380% increase, which was false. Dr. Perrin himself, a former conservative staffer, outlined this and called the leader of the opposition out on what he called, quote, the lies he was spreading. So I would encourage all of us to focus on what's most important, is that we can't treat someone if they are dead. That is why harm reduction is healthcare. It is a door to the system, and that is why we need to use every tool available to us to save lives, to get those we love into the treatment and healthcare services they deserve.
Thank you, Minister. I'm hoping I have a little bit of time left. I just wanted to focus quite specifically on SUAP. I really welcome the refunding of SUAP. I've also heard from some organizations that they have been waiting a long time, particularly with renewing successful projects, whereas the focus on SUAP has always been on new, innovative projects. Of course, we want to support innovation, but we also want to support ongoing success. And I wonder if you could comment on that aspect.
Thank you. And through you, Mr. Chair, what I'll say is we know how much there is a need for the SUAP stream. This last round of $144 million in funding saw over 700 applications and asks over $2 billion in cumulative totals. That being said, we have to find a balance to making sure that we are reaching as many communities as possible around the country, including rural and remote, and ensuring that there is low access and barrier-free options for those who are seeking healthcare services. We continue to innovate, we continue to try out new tools, but we also want to see what is scalable amongst those that are successful. So we do try to find the balance between both.
30 seconds, Dr. Hanley.
That's great. Perhaps I'll just jump quickly to the Emergency Treatment Fund. Again, welcome news that this will be occurring. And I know that this is scheduled for implementation in the fall. I wonder, you've already had consultations. Can you give me a couple, perhaps, of concrete examples of what this could look like for, say, a rural northern community like in my riding?
Briefly, please.
It will include looking at what the immediate needs are on the ground, whether it's drug checking services, additional training in naloxone, hiring of nurse staff and other healthcare staff on an as-need basis if there is a crisis, amongst examples.
Thank you. Mr. Thériault, we have 9 minutes to vote. Is it the will of the committee to continue? I don't see any objection. Are you okay to stay and vote here, Minister? Okay. Mr. Thériault, 2 minutes et demi.
Mr. Thériault, you have the floor for 2.5 minutes. 2.5 minutes. Madam Minister, in another discussion, you were asked questions and had a chance to discuss this in response. And I would like to know the harm reduction. The specialists came in to tell us that this is really the tip of the iceberg. It's the beginning of treatment, harm reduction. And the Benoît Labre, by the way, Maison Benoît Labre is a supervised housing site with 2 injection rooms. And when we traveled across Canada, we saw that success stories, people who manage to get out of their addiction, really depend a lot on supervised housing. So this is indeed a good harm reduction technique. So could you tell us a bit more about harm reduction and tell me whether you indeed feel, like the experts whom we heard, that this is the way to launch health treatment? Contrary to what the Minister of Alberta tells us, the Minister of Health, there aren't solely 2 approaches to life, misery or absolute treatment. There's something in between. I'd like to hear you on that.
Through you, Mr. Chair, I want to thank the member for the question and outlining the importance of harm reduction in offering a full continuum of care to those who use substances and struggle with the disease of addiction. I know Dr. Rob Tanguay, who is also ascribes to the importance of supervised consumption services as being an entry point into treatment, and is probably one of the very best entry points, is what he has stated, that we could possibly have for individuals who are most vulnerable. We need to have more, there isn't one size fits all when it comes to substance use and addiction. In order to meet people where they're at in community, we have to be able to open the door to show them that there is help available to them. Harm reduction is one of those entry points that is probably most critical for the most vulnerable, because they have been ignored, shunned, stigmatized, and in many cases criminalized, rather than getting the health care they deserve.
Merci, Mr. Thériault. Mr. Johns, please, for 2.5 minutes.
Thank you. Thank you, Minister, for being here. Now, as the process to develop a roadmap for the development of national mental health and substance use health standards wraps up, how does the federal government intend to address the persisting and serious gaps in the collection of quality, comprehensive, and coherent data across jurisdictions?
I want to thank the member for his question, and through you, Mr. Chair, I'll say we are always guided by evidence and data through CRISM and CIHR. We have a robust system. We collect data of collecting data and evidence, including through our SUOP projects themselves as a lever of assessment. And without that data, we can't know what communities need. Without that data, this is what is guiding us to understand what are the best tools that we can offer Canadians when they struggle with substance use.
Minister, analysis of the bilateral agreements shows that less is being spent through those agreements than through the Promised Canada mental health transfer. And in the wake of the closure of the Wellness Together Canada and gaps in consistent reporting to the Canadian Institute for Health Information on mental health and substance use health indicators, what is the federal government doing to hold provinces and territories accountable to ensuring consistent reporting on indicators and transparency and regular reporting on spending against priorities identified in the action plans?
Through you, Mr. Chair, I'll thank the member for the question. The Wellness Together portal was a once-in-a-generation or once-in-a-century investment where the federal government partnered in the unique situation and the demands and needs of Canadians for their mental health during the pandemic. It was never meant or intended to be an ongoing program. That doesn't mean that the need is not there, which is why in the bilateral agreements we ensured that mental health services were a key pillar in the provisions of signing those agreements. Healthcare belongs in the jurisdictions of provinces, and that is why we worked very carefully with them before shutting down the Wellness Together portal.
Very last bit of time. We had Dr. Sharon Koivu testify here at committee. She said she would table documents within a couple weeks. They've come to the committee. I want to make sure that those documents are available for the public. Can I seek unanimous consent from the committee to allow those documents to be released publicly to be examined by experts?
No, you don't have unanimous consent,
Okay.
Mr. Johns.
Mr. Chair, can I get an explanation on the rules that when this committee asks for documents from an expert witness, that information should be public? Because it wasn't an in-camera meeting, and the request was not made in camera. Can I get some clarification?
I'm going to actually invite the clerk to step in here, because the rules around production of documents are a bit complicated depending on the wording. There are 3 ways that a committee can compel documents, but I'm going to ask the clerk to help us with that.
Just very quickly, given the time before the vote, the document, to my knowledge, was not requested as an order for production of documents. It was requested as a request for further information or a question taken as notice. Documents that are tendered to the committee are the possession of the committee. The committee can do with them as they wish during this sitting. At the end of the sitting, all of the documents, unless they have been deemed by the committee to be confidential, are public. and they are available to be searched. So if the committee wishes to discretionally not release the document at this point, but have it be public at the end of the sitting, that is certainly within the rights of the committee to do so. If they want to render it public at any point, they can. They can choose to publish it on their website, or they can choose to designate it as confidential. All of those are options for the committee to consider.
Okay, Mr. Johns, that's your time. We can continue this conversation offline, I suppose. We've got about a minute before votes. I think we can get in one more turn, if the committee is okay with that, and then we'll vote, and then we'll suspend the vote. Everybody okay with that? Ms. Goodrich, for 5 minutes, please.
Thank you, Mr. Chair. I'm going to move a motion that I put on notice on Friday, June 14th, that given the large workload the committee has on its docket, the committee instructs the chair to book 5 meetings between July 8th, 2024 and September 13th, 2024 to deal with unfinished business and pressing matters facing Canadians, notably doctor shortages and the addiction crisis. Mr. Chair, we have been hearing very clearly very serious concerns, and so as such, I think that it is incumbent on each and every one of us to roll up our sleeves and get to work for Canadians, as that's exactly what they expect.
Thank you, Ms. Goodrich. Your motion is in order. The debate is on the motion. Dr. Hanley and then Mr. Johns.
Thank you, Mr. Chair. I have seen that this similar motions have been presented in many committees. So I would suspect that there is a partisan motivation behind this motion, and that it's not, we all face many pressing issues, both in our jurisdictions and as a country. We also have obligations to our constituents over the summer. I did notice that the member making the motion had posted some commentary about people taking a break over the summer and a summer vacation. That's although I hope we all take some rest over the summer, we all have work to do over the summer, and so I do not support the motion. I also move to adjourn debate.
Motion to adjourn debate is not
I requested a recorded division.
Directly to a vote. Could we have a recorded division on the motion to adjourn debate?
I ask for a recorded division.
A recorded division is about to take place.
Dr. Hanley.
Yay.
Sorry, the question to adjourn debate. Dr. Hanley, Madame Kayabega.
Pour.
Merci. Madame Brière.
Oui.
Dr. Pawlowski.
For.
Ms. Sidhu.
Yes.
Dr. Ellis.
Against.
Mr. Patzer.
No.
Ms. Goodridge.
No.
Dr. Kitchen.
No.
Mr. Delhiel.
No.
Mr. Johns.
No.
2, 4, 6. 6 nays, 5 yeas.
Okay. Next on the speakers list is Mr. Johns, and then Dr. Pawlowski and Dr. Ellis.
Thank you. So Mr. Chair, the reason I voted no was because I do want to speak to this. The Conservatives, we had a study, a tour across Canada that went to 13 different meetings, and the Conservatives failed to show up for 11. They talk about rolling up their sleeves, and I can understand individual circumstances surfacing, Mr. Speaker. We have that all the time. We've had colleagues lose family members and had to find subs. We have 25 members. They have 118 members, Mr. Speaker. But I find it interesting that the Conservative leader held a press conference in Vancouver with other MPs during one of the days of study at HESA, that they were able to find time to do a press conference on legislation that actually already exists, Mr. Speaker. And then they favorably showed up at a meeting that was held by the Alberta government and provincial-run facilities and not show up at the rest of the meetings across Canada. So, Mr. Speaker, Mr. Chair, I will say this. When the Conservatives go and meet those 11 organizations that took time out of their lives and days of saving lives, because that's what those organizations and people do, then I'm willing to talk about this motion. I'm willing to work with them on getting back to continuing the work we need to do. But I think before any further conversation about more meetings, I think the Conservatives owe it to those individual organizations and individuals and Canadians to go and meet with those organizations and listen to them. That's rolling up their sleeves, Mr. Speaker, Mr. Chair.
Point of order.
Yeah, a point of order from Ms. Briere. Go ahead.
Est-ce qu'on pourrait libérer la ministre si
Oui.
on discute?
Oui.
Could we free the minister if we're going to debate?
Underway. I am quite concerned that if we don't suspend the meeting and somebody has technical difficulties, that they're going to be denied their chance to vote. The minister has also reached the 1 hour that she had committed to us. So I'm going to thank the minister for being with us and give her the opportunity to vote. And then I'm going to ask to suspend the meeting until we're finished voting. We'll follow the same procedure as last time. If there's a will to come back before the normal time, I'll canvass the room. We do have some committee business to deal with. Minister Sachs, thank you so much for being with us. Make sure you get your vote in. It's that's why the good people elected you to be here. We appreciate, as always, your appearance, your flexibility with respect to the timing and the patience that you showed in responding to our questions. The meeting is suspended.
you.